Hello, I'm Helen and this is Mallorca Living, a space dedicated to those who are dreaming of making Mallorca their home. Today, I'm delighted to welcome Dr. Carsten Henningsen from Palma Clinic, who's going to tell us more about the healthcare landscape here in Mallorca. Let's dive in. So, Carsten, you're very welcome to Mallorca Living podcast. Thank you for being here.
Thank you very much.
Yeah.
Inviting.
So, I want to talk to you today a little bit about the healthcare landscape on Mallorca. So, you've been here a long time. I think we originally met at one of our business lunches.
Exactly.
I don't know how many years ago is that?
17 years ago.
17 years?
No, this is 16 and a half.
Okay.
I came here in 2009.
Wow.
Like an April Fool, 1st of April, I was announced.
Oh, really?
I came here
Okay.
Of 2009, yeah. And then we met on your business lunch.
You joined our business lunch, and that's where we met. And when did you establish Palma Clinic?
When I came here, exactly more or less 17 years ago, there was no Palma Clinic. It was a couple of doctors, Dr. Raz and Oliver Haag.
You mean foreign doctors on there?
Foreign doctors in there. And they asked for a guy like internal medicine. And
that's your speciality, is
specialty.
Internal medicine. Yes.
Yeah, including gastroenterology and cardiology and these things. And as I have a little bit business experience from my time in Germany before, I told them, come on guys, we have to improve the system a little bit and make it a little bit bigger for the people, for us, for everybody to have, to continue the really good service, but to make it bigger because we knew there is potential in Mallorca. Yeah, to provide a really good top level service, and but to have a little bit more discipline and more other specialties, and then we grew. And now,
so the original idea, bring these competencies under one clinic.
Yes.
and collaborate with various specialists from different sectors.
We started really small. We started with a gynecologist, with a pediatrician, with orthopedics, and with myself, like internal medicine.
So there was 4. How many
4.
are you today?
Today, to be honest, the whole, I don't know, is around 50 people.
50 people, wow, it's grown a lot.
But the discipline is around 10, but maybe we're in the next month we are 11 because we are looking for a psychiatrician as well.
Okay, very good, interesting. Yeah.
And running really good, and we're a little bit proud about what happened in this
Yes,
year.
You've really established a great name for yourself on the island.
Yeah.
So generally, your patients, are they from all over the island, or are they generally, within a close radius of Palma?
No. The idea is, okay, we are working together with hospitals. We are not a hospital, we are a clinic for outpatients, and we try to avoid the staying in the hospital. But the people come from all over the island. If they, for example, need a second opinion, or if they think about to go into a hospital, and to have these. We are, there on the Via Cintura next to the hospital.
It's very accessible, yes.
Big parking, so the people can come from everywhere of the island. But they're not just coming from Mallorca, to be honest. They're coming from Ibiza. We're next to the airport. They're from Menorca.
Oh.
There are a lot of people, foreigners, coming from, from Germany, from the UK, from everywhere, Switzerland, Austria.
Wow.
We've got international.
Wow, okay.
patients.
And does it take a long time to get an appointment with yourselves?
No, normally not. Okay, our idea is not to treat 100 people per day. Our idea is to treat people, as much people we can do with the time they need. Means around 10 up to 20 people. But we are organizing these like there are no waiting times, but sometimes 50 minutes or something like this. So they can get an appointment. If this is an emergency case, high urgent, then on the same day normally, or if not, in this week or the next week.
So it's always accessible, let's say.
Yeah.
So you have managed to attract highly talented, qualified, experienced professionals, medical professionals over the last 17 years. How did you manage that? Because I guess it's not so easy on the island to find people who are extremely qualified and have experience. How did you manage to attract these people and bring them together?
It's a good question. It's still hard work because, of course, Mallorca is super attractive, not just for people for doing holidays or for people living here, just for people working here, especially for medical doctors as well. But we cannot give chance to everybody. We have to select the people, of course. But to be honest, as we've got a really attractive location, we've got a name, but it was hard work over the years. We've got a lot of people asking, can we work? So in the moment we're in a little bit luxury situation, we can ask for that we can elect the specialist.
Yeah.
Sometimes it's not working because mostly not because the quality standards, mostly it's because they're personal.
Yes, situation.
Yeah.
And they end up leaving the island or something like that.
Most of the people they are not coming from Mallorca. They are coming to Mallorca. So
yes.
They're at the international. They have to have all the papers. This is the first thing. Without the papers, they cannot work. This is administration and things like these, and then of course they have to feel good here, but most of the times working really good because the perspective for the people working here, like a doctor, they're good, and the quality for life well-being for them is good as well, and it is not as stressful as it is, for example, in Germany.
What kind of values do you propose with Palma Clinic? What is the core values of your clinic that you feel, I will not compromise on this? This is for us the most important.
The most important, of course, is the high-end quality, but in combination with our staff, with the friendliness, the people, they have to feel good because they are not coming in a restaurant. They're not going in a restaurant. No, they're coming because they've got a problem. We have to solve this problem and manage this problem. And after this, they have to pay for this as well. So they have to feel really good. And this is, I think, in these, I don't like to say this, but it's like this, we're the best on the island.
You're the best on the island. Yeah. You say humbly. No, but well, actually, I have experience because I'm actually a patient of yourselves for many years, and I have really seen over the years how you have evolved, and it feels to me that one of the core values is like you say, this standard of service. And the patient is always at the core, at the most important point of everything, how you're going to look after that patient. And sometimes you have to go through bureaucracy with insurance companies, with hospitals, and I think your staff are used to just pushing through and making sure they get a good result.
Yes, exactly. Okay, we are used to do these. Of course, this is sometimes a little bit. This is not really. This administrative work is never the work for a doctor loves. This is a work. This is a must to do, not a like to do. But we are used to do these, and finally, it is a lot less in at least my home country.
So, Carsten, your typical patient is obviously international because it reflects, it mirrors the island. No, there's people from all over the world coming here. Do you notice a difference in what they're looking for depending on their nationality, or is it in general that there's a commonality where people have similar expectations?
This is a little bit difficult because finally this is everywhere the same. The people have got problems and they like to have a solution for the problems.
Of course.
Okay? And we can provide a lot faster solution than normally. Okay, and then this they know, and this is the reason, the expectation they're coming. for, because we've got a lot of these specialities under one roof. And if I've got a problem, I think this is for example, neurological problem, I can send it directly to the neurologist or dermatologist or ophthalmologist or orthopedics or whatever. This is one thing, this service and high-end quality. And the other thing, of course, people, I don't know if this is related to Corona or not, but they are taking a little bit more care in general lifestyle, doing more sports, but they like to do a little bit more preventive things as well.
And the island fosters that well-being.
Because you can do a lot of exercise, whatever you like, the water, the mountains, cycling, whatever you like. And of course, they like to know their success with these and ask, okay, now I lost some kilos and my laboratory results, for example, cholesterol, blood pressure improved, and I like to check these. And this is a preventive thing. What I like, because helps a lot to keep your health good before you've got a problem.
Yes, exactly. Yeah. So prevention is becoming much more prevalent, I think, in medicine in general.
More present in the brain and here, because people are looking good and they like to look good and they take a little more care.
A little bit more care in staying fit and healthy, exactly. And people, I think, also now are conscious that they want to, let's say, grow old, but maintain their health.
I think this is the most important. This is, for example, the word anti-aging is not the right word, because longevity is a word, or well-aging, or whatever, to get old, but in a good physical and psychological condition, and this is related together as well.
Yeah.
If you not feel good, then your brain is not good.
Yeah. So the awareness in general, I think, has improved an awful lot.
Yeah.
So what about, because you have a lot of experience, people who have really a serious problem and they're living here or they're here on holidays and something happens. What is the medical care like in Mallorca for that patient?
Okay, there are a lot of different possible problems. For example, if there is a car accident, severe car accident, what could happen? Then the people, they need to go into a hospital. This is not what we are doing. This is we can do it by side and help and moderate the things, but we've got some really, really good hospitals for these. For example, the public system, Sonnes buses, they're really good in traumatology. For example, if something like this is happening. Cancer, unfortunately, this is happening here as well. But the treatment is, we can take care in our clinic just to moderate and help and support all the things. But normally they are doing this in the hospitals, where we've got a really good contact with the hospitals, and the treatment is perfect.
And so some of your doctors oversee the treatment for the patient with cancer. So they're helping to coordinate, they're checking the results.
Things, or if they things you can do a little bit faster in the hospital, we are doing these, and the general treatment, for example, chemotherapy or special therapy, this is not what we are doing. But these 100 meter across the parking, there is a hospital, and they've got a really good oncology department, for example. But
and you collaborate with that department, the oncology.
And if there's a problem, for example, with the language, or to understand the disease, or to understand the treatment, we're helping for this. Yes.
Yeah.
So,
so these are the kind of serious things, like our heart condition. Somebody has a serious heart condition.
Serious heart condition. Or me, by myself, I had an operation with my spine because I had a stenosis of the channel, and I did it here because I got got an offer in Germany to do these, but I did it here, and I'm so happy to do this here because the treatment, minimal invasive. And I was 1 day in the hospital in Germany. I had to stay there for 3 weeks. So I don't like to say Germany is bad. It's nothing what I
No, I don't think that's the point. I think the point really is that here is at least as good as your home country, and depending on the circumstances, can be maybe a little bit faster and more.
Most of the time, it is faster.
It is faster.
The quality at least the same. If this is faster, sometimes better, the quality. And
maybe you get more individual care here. Would you agree?
Yeah, medical care, because we are doing these a little bit. If these are our patients, we take care about these, and then we are of course more individual care. In the hospital, this depends a little bit, to be honest, because the people, the nurse, here the people, they are used to have some relevance. They are helping a little bit in the hospital.
Yeah, it's a different culture. It's a little difference in the culture. Yeah. Maybe just to explain that when you're in hospital here in Spain, I think in general it's like this, that a family member, and often there's a bed provided for the family member in the same room. But the idea is that family member is there to actually look after you with your needs, to do, whatever your needs are. And the medical staff are more dedicated to prescribing the medicine, making sure that
operations and these things. Exactly.
Yeah. Exactly. So it's a little bit different in the culture, but maybe it works quite well here.
Of course, it's working really good. And as I said, the idea is, in general, the medicine change. Normally there are not a lot of people. They have to stay in the hospital for longer than a couple of days. And for a couple of days, if they are next to our clinic, of course we are going there and making a consultation and saying hello. And if they've got some family member, they are there, and that's it. It's completely okay. Mm-hmm.
So with your clinic, majority of the patients they're using their private insurance. Many times the private insurance is from their home country, right? Mm-hmm. Or they're self-pay. It's that
most of the people, they've got a private insurance. This is completely different because our patients are worldwide. US now with these direct flights, whole Europe. German and English speaking. In the summertime, a lot of people from Australia and New Zealand and all these, the whole world. On the whole world, they've got a different insurance. Sometimes it's just a travel insurance. Of course, if there's an emergency case, and they will cover these. Some people, they've got insurance, for example, in Germany or Austria or wherever. And of course, they cover these, private insurance. And some people, they are living like long-term residency, and they've got insurance with a DKV, AXA, MAPFRE, Deslat, or whatever. And the private insurance, they cover these as well. So self-payment, but this is not the main. Most of the people, they've got a kind of
insurance, private insurance, yeah. So what do you think of the healthcare system for those who are not fortunate enough to have private insurance and are more relying on the social security system? What is the general health care here?
It is, as I mentioned, the same. If there is a serious problem in the public system, this is working really good. The outward patient, the ambulance patient, this is the same. The waiting time is long. So my recommendation, if you are planning to live here longer, than to do a private insurance, and they are not so expensive. For example, in Germany, they're a lot more expensive because the system is completely different.
And would the Spanish insurances cover your fees generally?
No, the public system is not covering.
No, but if you have a Spanish private insurance, people can attend your clinic. Right?
Yeah, of course.
Yeah,
of course,
okay.
Of course.
And they pay.
They pay and they get the money back with a reimbursement.
Okay.
Yeah, and for the public system, most of the time this is working as well good, and we've got a lot of Spanish people as well.
Yeah, that's why I wanted to ask you that, if you have a lot of local people.
Yeah, then they are coming because, of course, they prefer to go to a Spanish doctor, okay? And they prefer to go to the public system, but sometimes they have to wait a little bit too long. They know, okay, they are really good with these, and then they're coming, this is self-payment. And this is, most of the Spanish people are self-payment. But they are not coming the whole time because the basics they are doing with the public system, And yeah,
But if they have a need, yeah.
they need a second opinion, or something like that, then they come in and they're paying.
Okay, very, very good.
Yeah, this is we never had a problem with the payment for the leases.
So your proximity to Palma Planas is obviously very, very close. Do you also use other hospitals,
Yes,
or
of course.
you do? So it's not that you're 100% with.
No. This I don't like, and this is just the Palma Planas. This is closed. I'm doing, for example, my endoscopy thing in the Palma Planas because it's 100 meters over the parking. If we need high urgent, for example, CT scan, we use these. But for example, for other different things, we use the Clínica Roger in the city, or the Clínica Rouaneda, which is not far away, or Clínica Miramar, or if there's something really special with oncology treatment, and this is Solis Passes, which is a public system. No, we collaborate with all of them.
Okay.
Yeah.
And is your one location at the moment is the clinic here in Palma, or do you have other associations, let's say, or collaborations?
The Palma Clinic.
Yeah.
We are our main business is in Palma, and we collaborate with people. For example, in Calamillor or in Santani, but they are not part of the Palma Clinic. They are just collaboration.
And they're referring you
Exactly.
patients because maybe it goes beyond there.
For us, this is difficult to have the same standard what we have in the Palma Clinic, to have these in several different locations. This is difficult.
And it's easier generally for the patients to come to you, and you can. And within the clinic, can you do a lot of, if you need to do blood tests, X-rays, these kind of things, you do it within the clinic rather than.
The only thing what we are not doing is intensive care, for example. We cannot do the big machines in radiology like MRI scans. We thought about to do, but there are a lot of people that are providing these. This doesn't make sense. CT scan, every time we are thinking about these, but it just doesn't make sense because all the clinics, they've got these. And
also you get an appointment very fast.
Yes,
I mean,
exactly.
it's efficient. It's not that your patients are waiting a ridiculous length of time, and therefore
MRI scan more or less the next day or the day after. Emergency CT scan is the same moment, and the X-ray we're doing by our own. All the ultrasounds around we're doing by our own. The X-ray third, but blood tests we're doing by our own. Or we're sending to Germany. They've got these next day, the results. Now, with these, we are completely independent. Bigger operations we cannot do. And we don't have beds for overnight care.
Yeah.
We are thinking about, but to be honest, we've got the hospitals. Why?
I would love to ask you to do a favor for me. Mallorca Living is a video podcast dedicated to those who are dreaming of making a life for themselves here on Mallorca. This is a very personal project for me, where I get to share with you wonderful stories about people who have actually made the transition to Mallorca. I would love to ask you to subscribe to this channel, because it helps the channel grow, and it makes sure that we continue to grow and prosper and reach as many people as possible who are interested in making Mallorca their home. Thank you so much for subscribing and liking and sharing your comments. We love to hear your thoughts and your feedback. Thank you so much. And the hospitals do function very well here. Yeah. I think that's what we want to communicate, really, because I'm sure for people who are thinking to relocate here, sometimes it's a big concern. What is the healthcare like on a small island like Mallorca? Because we're 1 million people. I mean, there's many.
They don't need to worry about these, because not at all. Because now I know more and more, to be honest. It's a little bit more after COVID, after Corona. A lot more people in Mallorca after Corona, because home office and these things, I think. But a lot of people, they are coming. Okay, now I'm talking a little bit more about Germany, because they cannot get an appointment in in Germany. And
even with private medical insurance?
Even with private medical.
Wow.
This is a little bit easier with private, but not a lot. And then they are flying in. We've got a lot of flying in patients.
Wow.
To get the things done, and then
because it's faster.
Service a little bit better. This is what they're saying.
And the price, obviously, they pay with their insurance. So
our price is a little bit more expensive. This is what we have to say than in, for example, in Germany. But this is not the problem, because the prices from private insurance, they will kill me if I say this, but it's like this. This is low, and we are not like the United States. It's somewhere extreme. But we are a little bit higher service orientated, but our prices are completely okay. And they, for example, private insurance, English or German, they are paying these, and the Spanish as well. So this is completely okay.
It's normal.
Yeah, it's normal.
Very good. Well, thank you for all that information you have provided to us. I want to talk to you a little bit about your own personal life, okay? So you chose Mallorca. Why did you decide to leave Germany and come to Mallorca?
Yeah, I expected this question. Okay.
You expected.
To be honest, it was a little bit an accident. I don't know if you know, I've got a Brazilian passport as well.
Okay,
yeah,
I didn't know that.
No, okay, because I'm not looking like a typical Brazilian.
No.
But anyway, my mother, she was born in Brazil.
Okay.
So I've got a Brazilian passport. And my whole life, I traveled a lot with my parents to Brazil or somewhere else. And every time I was thinking, okay, do I like to stay my whole life in Germany, Hamburg, super nice city.
It's beautiful, yes.
Beautiful. And no, but okay, anyway. I had a really good job in Germany, but it was a little bit like running the same. I was a doctor, and I was a kind of, not a general manager, but a manager in a clinic. But I had to do a lot of negotiations, reunions, meetings, and talking about administrative things. It was
boring.
It was a little bit boring. And then I read in the newspaper from Dr. Ross.
Okay,
yeah,
I know Dr. Ross.
Yeah, I know, you know. They're looking for a guy like me. And okay, there came a personal thing as well. And I knew Mallorca from sailing a couple of times.
Yes, you're a big sailor.
Yeah.
Yes.
Big, I don't know. No, but I love to sail. Yes.
Yes.
And then I made a kind of holidays for 5 days. I took my sister and my brother-in-law, and they came here. Come on, we'll have a look how Mallorca is looking like. And then I met these people, friendly. I looked around. I said, if not now, when then? Or never now. And then I decided, not really fast, or after a couple of weeks, I think, yes, let's do. My parents, they weren't really happy about this decision.
Really?
Yeah.
Your father is a doctor as well.
Doctor as well. My sister as well.
Your sister's a doctor, so it's really in the family.
Yeah. She's a cardiologist. My father, internal medicine like me, and he was my teacher, for example. It was really nice.
So he wasn't planning that your career direction should take you to Mallorca.
Yeah, but anyway, then I came here, and okay, to be honest, after the first 3 months, I thought, oh my God, what did you do? Because it's completely different things, and
it's also 17 years ago. It was Mallorca was quite different.
Yeah, it was different, and I had my 30th birthday. But after 3 months' time, I thought, okay, this is not bad. Started to run the things, and then I had a lot of ideas. And then today, I would say to go back, if I don't have to, I don't do.
So you would say it was a very good decision, what you made.
It was a very good decision, but you have to. We don't need to lie. This is not 100% everything is super fine in Mallorca. Mallorca can be a pirate's island sometimes, and you have to be careful here and there. You know these, no te preocupes, don't worry. Then you have to run away and worry.
Yes. When you hear that, it's like alarm bells, right?
Exactly.
There's something wrong and nobody's telling you. Yeah. Okay, so when you think about now your move and everything, it was a long time ago, what do you wish you'd known then that would have maybe helped you now that you look back in hindsight?
What can I say? Okay, this is difficult to say in a couple of words, because what you have to be but I think I was, and this is helping. You have to be really open-minded and not to be afraid if the things are not running or working like they should work, or like you know how normally they are working. And here, I think one other thing is to have a plan is a good idea, but to be able to change the plan is even
Be
better
flexible.
idea. Be flexible.
And
Flexible.
patience, I think.
Patient you have to be. Depends to your own experience. Okay, Germany, we are used to have the things clear, these and these and these. Or sometimes there is a surprise, but normally it's working. This is here different. But this can be great because if you're able to assimilate and think, okay, maybe this option is even better, I didn't think about before, and you're open-minded and flexible.
I think that's what you at Palma Clinic do very well. You bring the German efficiency, but with a kind of a landscape or a surrounding of this more relaxed Spanish culture.
Yeah.
And that's quite nice. It's a nice experience because on one hand you're confident that you're being looked after and you're in good hands.
Yeah.
But at the same time it feels good because it's warm and friendly and nice.
Yeah, because
and that's a beautiful combination, actually.
Exactly, and I think the most important is open-minded. Be open-minded. Stay friendly and cool and
relax.
And important is high professional. If you start something here, because you didn't work in your country and because of problems, they could be a little bit problematic. You have to have a really good standard in your profession, and then I think, and then a little bit patient, open-minded, not to be afraid, and then these things are running.
Did you feel frustrated by that when you arrived here initially? Because, you know, when you're in the operating theatre or whatever, you're used to certain standards. Did you find it difficult to get the same kind of, reach that similar standard?
No, you have to change your mind a little bit. Here, the rules are a little bit different than there, and you have to adapt and change a little bit your standards, not in a negative way, just to organize a little bit different, and then these things are working. But if you keep on these, I like to have these like this, because I'm doing this every time like this.
You can run into problems. Yeah, it can be life in Mallorca then starts to get stressy, and maybe it's better you go somewhere else actually.
Exactly.
Because but I agree that you have to be quite open-minded, a little bit agile and adaptive. Very good. So what about the business side? Because obviously Palma Clinic on one side, it is an important clinic on the island, but it's also a business.
Yeah.
What was your experience setting up this business here in Mallorca?
It's the same like what I said before. You cannot expect that things are running like you would do this in Germany. To be honest, I think this Palma Clinic, this system, what we create, what we did, this I couldn't do finally in Germany the same, because some rules there are
the bureaucracy.
Bureaucracy, exactly. Now, the way there it was hard, and you have to. This is the same. You have to fight against a lot of competition partners. Mallorca, what I said, sometimes a little bit pirates island. Not all the Mallorquin people have been really, really happy that we came and installed the Palma Clinic. Now, after years, we're collaborating with all of them. But the people, they didn't wait for Carsten Henningsen when I arrived here. And of course, there are some other competition partners. But this is the same. You have to be a little bit straight and tough to do these.
To survive,
yes.
And grow.
But if you're good in these and you've got a little bit of patience and
And in the end, it's all about reputation. The island is a very small place, so your reputation is your most valuable asset, right?
Of course, you can you can do marketing as much as you want. If the people are talking bad about you, that is not working. Yeah. You don't need to do a lot of marketing if the people are talking good about you.
Yeah, because it's mouth-to-mouth recommendations. Exactly. It's your best source of new clients. Carsten, where do you live on the island?
When I came here, because in Hamburg I was used to live in the
by the sea.
I grew up with my parents in Germany on the countryside, and then in Germany, and I lived in the center, not in the center, but in Hamburg, really central. So when I came here, I like to live central as well. I had an apartment in Santa Catalina.
Beautiful, very lively spot.
Yeah, 17 years ago, it was a lot less.
Of course.
And then, it was a lovely apartment, and for the weekends I had the idea to have a finca somewhere, and then I had a rental for a finca, for a huge finca. But to be honest, after 2 years I thought no, and I had to decide.
Finca life wasn't for you.
No, finca or sailing, and then I gave the finca back and said, "Come on, we go sailing." And now I'm living in Molinar, next to the beach.
El Molinar, just for anyone who's listening that they don't know this area, it's beside Portugal.
Yes.
It's between Palma and the airport.
Yes.
And it's probably the most expensive area per square meter on the island.
It's starting to be like this.
And thanks to the Swedish people, actually, because the Swedish made...
But you have to, this is super nice, because it is never too full, in the summertime, but there are bars, restaurants. A lot of Spanish people, not just foreigners.
It's very local, actually. It's a very
super local, mixed, and super friendly and super relaxed. Because in the evening, after working, I go to the sea and going for surfing, for example.
Are you on the first line of?
I'm not in the first line. I'm in the second line. First line I don't like, because the whole time the water, the wind is coming in your terrace.
Yeah,
but I've got a rooftop terrace, and then I can look to the sea on the second line. And after work in the summertime, taking my surfboard and going to the sea.
Do you have parking there?
Yeah.
You have, because parking can be a bit of a challenge in that area.
Parking can be, like everywhere.
So do you, because I always relate Portugal and El Molinar as like the healthy spot for Palma, no? Because you have the promenade, as you say, you have the sea, you have so many things. And I think even if you weren't a sort of sporty person or active person before, if you live in this area, you're going to want to walk that promenade or run it or cycling,
swimming, whatever you like, or paddle is somewhere next, and you can do everything. This is really a nice quality of life.
And it feels a little bit like California, or it could be Australia. You know, it has that kind of vibe, doesn't it? In the
summertime, because all the people on the beach. The beach is big enough. You don't. It's not too small. And all the people, they making, I don't know, playing volleyball or tennis or swimming, surfing, whatever. This is a little bit like, how's it called?
Venice Beach.
Venice Beach.
One of these.
Because sportive people. Doing
it really, I think it's an area, if you're an active person and you love the outdoors, this is the ideal location, right?
If you just like to walk, you can do the same. This is you don't need to be a professional sportive.
No, not at all. But what I mean is, if you love being in nature and by the sea, it's beautiful. And of course, you actually can walk into Palma, into the center, or cycle, or take a bus, or there's many possibilities.
By bike normally, and go there, for example.
So how long are you living there now?
Now I'm living there since, I don't know, 5 years.
5 years. So
I've got 2 flats in Santa Catalina as well. But I thought, if, for example, in summertime I'm living in Molinar, in the wintertime I'm going to Santa Catalina. But to be honest, Santa Catalina now is a little bit too full from my opinion. I love Molinar, so I will sublet these.
Okay. So you really feel settled in El Molinar?
Yes.
It's your location, and you don't want to finca. Your finca days are over.
Finca idea is gone. Last year I had a look for another finca. I thought about why not. I said no, this work. I've got enough work with my sailing boat, for example.
Yes. And where have you moored your sailing boat?
This is in Club Nautico.
In Club Nautico. So you're like 10 minutes away, right?
Exactly. From home by bike, cycling, I go there 10 minutes. And for example, if I need a bed after Friday dinner or something like this, I can sleep on the sailing boat. This is perfect.
Beautiful.
This is luxury.
So where do you go sailing? Tell us about your sailing life in Mallorca.
Yeah, okay. Normally I'm going sailing around here.
Around the Bay of Palma.
Around the Bay of Palma. In summertime I'm leaving for a couple of weeks. The boat and me, we are leaving and going to, for example, Porto Colom, staying there, and from there to go to Mallorca to have a trip around some bays.
Mallorca is beautiful for sailing. There's so many beautiful colors.
But with these boats, wouldn't be a problem to go, for example, to Sardinia or.
Really, it's a big sailing boat.
Yes, this is not a really big one, but it's 12 meters, 30 meters. But it's safe enough. There, we've got a problem with the time, because for this year we need a little more time, and my time.
You have limited time.
Yes.
Yeah, because you're still busy working, but that's maybe not forever. So.
No. But it is completely okay in summertime. Our high season in summertime. The high season is mostly starting in October until June. This is a high season, all these. And in the summertime, because a little bit hot somewhere here, people are leaving to go for holidays, or then for us it's not the high season. And then we can do holidays as well and go sailing.
Go sailing. And that's your passion, no?
Yes.
Sailing.
Passion, yes. One of these.
And what else?
Water sport. In general, water sport. Years before it was golf, but golf and sailing, this is, then I can stop to work. And but water sports in general, it means windsurfing, kite surfing. I was used to do, but these I stopped. And now I'm trying to do these wing foiling.
Okay.
It's a little bit difficult.
Okay.
I have to learn these. And wave riding.
Okay.
Depends. And sailing, of course.
So the water is your playground.
I love.
Yeah, the water is your playground. And now, of course, when you live on an island like Mallorca, you have so many options, right?
Yeah, it would be a disaster not to go to the water, to be honest, for me.
Yeah. No, but it's beautiful. Yeah. So I don't think you have any regrets leaving your home country and building a life, creating a life for yourself here?
Nope.
Okay. So for somebody who's in their home country and they're dreaming they're listening to your interview and saying, oh, I would love to do that. What kind of advice would you give somebody?
Yeah, this is what I said before. This is to be, if you do these 100%. Or this is how I did. If you run a business, if you come here to have a look, okay.
Give it a try.
Give it a try, exactly. But not with your own business. Then ask for employment somewhere. If you do a business, then you have to do it 100%.
Yeah.
And,
but a lot of people are coming to the island and actually they have business elsewhere, which
yes.
is
if they
perfect.
Can do these like these, then I think one of the most important things is to learn Spanish. Not Mallorquin, but Spanish. Is a lot of people, they come here and think, okay, with English or German, must be enough. No, we're living in Spain.
And it's really like a key that opens the door, right? You have just
doors,
many other options when you speak the language.
I think this is in the moment the most important. Learn Spanish.
I would agree with you. It gives you so much more enriching experience
than respect to the people from here, to say, okay, this is Europe. But this is not Germany, this is not England, this is not United States, it is Spain, part of Spain. And the people are not getting more stupid about learning another language.
Exactly. It's helping the brain.
Yes.
It really is. Great. Well, thank you for all of that. I want to ask you our quick fire questions before. So I think we already know the answer to this. Your favorite is beach or mountain?
Oh, depends a little bit. Okay, in summertime this is the beach, water. Winter time it could be the mountains as well, because I love these mountains. I love
And you
skiing,
go hiking? You like hiking?
hiking, for example,
yeah.
yes. Or no, wie heißt es hier? The water. No, I don't know the word at the moment. If you go down through the small rivers in the mountains.
With the kayak or something like this.
No, not rafting, not the.
Oh, right.
Because not the. No,
but running.
Not running with the ropes.
The climbing and all of this.
Yes.
Okay, you like to do that?
No, I did a couple of times, and
Okay.
to be honest, I'm not used to, but I like.
Okay.
But I'm not really used to.
Okay.
Something to learn as well.
Okay, very good. So you're very sporty. Sunrise or sunset?
Sunset.
Sunset. And summer heat or winter calm?
To be honest, winter calm. Summer is too hot sometimes.
Really?
Mm-hmm.
And are you siesta or fiesta?
Both.
Both, okay. And Pamboli or Ensamada?
Pamboli.
Okay. And North Coast or South Coast?
Oh, that is a difficult question. Depends to my mood, to be honest.
It depends, but the North Coast is very beautiful.
Very beautiful, yeah.
And the South has plenty to offer too, so it depends.
It's completely different.
Yeah, it's very different. And we're lucky to have both, right?
Yeah.
So Carsten, thank you so much for joining me here today. It's been really a pleasure. We've learned a lot about the whole healthcare landscape on the island. And I think it's been really informative for anybody who's thinking of moving to Mallorca. So thank you so much.
Really welcome.
Great, thank you. If you're dreaming of making Mallorca your home, let me invite you to use our property buyer's agency service. With our service and our help, we can guide you to the right location that fits with your lifestyle. We'll also help you find the perfect home that fits with your dream. Contact us today for an online consultation or book an appointment and come and see us in Palma. We would love to help you make your transition to Mallorca a reality.